Okay, you should be good to go.
Awesome. Well, good afternoon, everyone, and thanks so much for joining once again the provider update. It is Tuesday, November 9th. We've had kind of a crazy couple of weeks with booster implementation and vaccinating kids 5 to 11. So just kind of want to take a breath and do a short presentation of updates and some data, and then have plenty of time for asking questions. Dr. Perron, is there anything that you wanted to share with the group, or just we'll go through the slides?
Oh, definitely. Let's just go through the slides, and then I just wanted to give like a brief update on the messaging around the boosters, if that's possible.
All right.
And that'll be like on slide 16 or something.
Oh, okay, great. All right. So we have our DOH mission, and then here's our COVID-19 overview. So again, and none of this is new, I know. Unfortunately, we are seeing an uptick in cases and an uptick in percent positivity. The amount of testing that is going on across the state has been pretty much flat. So I mean, still a large amount of testing, but the amount of testing isn't really going up, but the number of positives is. I think that is reflective more of people, just being kind of sick of testing, or maybe testing at home, and not so much lack of test availability. Thanks to everyone, we're still doing pretty well with that. This is the percentage of new cases each week, and we just thought this was interesting to look at this yellow band, which is the 5 to 17-year-olds. So we do, all of us, I think, are asking the question, like, why the surge? We have overall a relatively good vax rate in the state. We have an indoor mask mandate, seem to be doing everything right, and the cases continue to go up. I think all of us feel somewhat frustrated by that. And I don't think there's one single answer to why that is happening. But it is interesting to look here, the 5 to 17-year-olds, which are unvaccinated because vaccine has not been available to them, at about 10% for lots of the summer and or lots of last year. And then as schools open, start to tick up to about 20% of cases. So, I think, as we all know, that is kind of a high risk, school's a little bit of a high risk environment, and all the more reason to be excited to be vaccinating kids 5 to 11 now. This is the infection rate, or R effective, for the state at 1.15. And again, that's just tracking, when that number is below 1, in general, the cases are shrinking. When it's above 1, it means cases are still on the rise. Everyone who has COVID is giving it to more than one person. On the good news, vaccine administration has basically tripled in the state. So if you look back here at the week ending 9/23, which is when Pfizer was approved for its booster, we were doing just a little bit over 20,000 doses a week. And this 2 weeks ago, the Friday 2 weeks ago, we were up above 60,000. It was about 65,000 doses, federal and state. And this last week, we hit, I think it's just a little bit above 58,000, with still, we know, there's often like a little bit of a lag until we see the total, but just really an amazing effort across the state with everyone involved at getting those doses up. This is our vaccine progress. And again, these numbers of first doses and second doses, they do keep creeping up, but definitely where we're seeing the most movement is in boosters and in primary doses for kids. I always think this is interesting to look at, just if we feel kind of like what's going on here in New Mexico, and then put it up against the national curves, we just tend to follow right along. So this is total vaccine doses administered. We're seeing an uptick. There's also an uptick across the country. So the US is in gray, and New Mexico is in red, with different axes, obviously, for for the two volumes. This is first doses administered, so just tracking how many people who haven't been vaccinated are now getting vaccinated. So a little uptick there, both nationally and in New Mexico. Okay, I thought it was time to resurrect the Swiss cheese slide, which is basically what we talked about at the beginning of the pandemic. There's no single silver bullet for this pandemic, and we really thought, vaccines might be it, but lo and behold, it is not, even though vaccines, again, are highly, highly, highly effective, and the vast majority of the cases, still about 90% in the state, are in unvaccinated. But again, we just have 2 more layers of Swiss cheese, vaccines, and boosters. All of them are important. This original slide came from a slide deck of Dr. Scrace's, and it always just like made a lot of sense to me. So there you have it. All right, here's boosters administered. As of 11/6, we were over 200,000. This is comparing the vaccines by brand. Not much is really changing here, except for Moderna starting to click up as we're now about 2 weeks into the boosters. This is boosters through November 5th, using everyone 18 and above who's 6 months out from Pfizer, Moderna, or 2 months out from J&J as eligible for the booster. So not taking into account whether you have an underlying medical condition or if you work in a congregate or high risk work environment. But just the total number. And so we can see with Pfizer, we've been at it for about a month at 37%, Moderna 19%, J&J 2%. One little caveat on this is if you are a J&J person who gets a Moderna booster, your booster ends up in the Moderna column. So this may not be fairly representing what's happening with the J&J group. Okay, 5 to 11-year-olds, sorry, this data is brand new and kind of a rough slide, but basically as of 11/7, which is our most recent data, 991 first doses for kids ages 5 to 11 and 29 fully vaccinated, which is kind of interesting, but a few we all know have snuck through and gotten vaccinated when they were younger than 12. It wasn't it was a vaccine error at the time, but now they're legit. For pediatric Pfizer, again, no real updates here, except for just, again, stressing over and over, there's a purple for people 12 up, a purple cap vial, and an orange cap vial for people 5 to 11. They are not the same formulation and shouldn't be used interchangeably. Having said that, there's all these little circumstances where people may or may not get the right dose. So I'm just going to run through them quickly just to kind of put them into, just put them on people's radar. So if a person is 5 to 11 and gets the adult dose for their first dose, they, basically nothing to be done about that. They've already had it, and you just follow 21 days later with the age appropriate dose. If a person is 5 to 11 and gets the adult dose for their second dose, same thing, nothing to be done about it. The series is considered complete. You do not have to go back and give another 10 microgram or pediatric dose. If a person in the 12 to 17-year-old category gets the PEDS dose, the 10 microgram, and really they should have gotten 30, in general, don't repeat the dose. The CDC does have this in some situations. If an adult dose is warranted, then give it 21 days after the incorrect dose. And this is the instance they give is like if someone 12 to 17 actually got 2 10 microgram doses, that's a person you might want to say, you really should have gotten 2 30 microgram doses. Let's go ahead and give you a third dose. But you're going to space that out 21 days after the incorrect dose. And almost lastly, if a person 18 plus gets the PEDS 10 microgram dose, then the recommendation is to repeat the correct dose immediately. So if you did the 10 microgram in one arm, turn around and give the 30 microgram in the other. Just a reminder, no booster or additional doses are approved yet for kids 5 to 11. So even an immunocompromised 5 to 11-year-old, you don't give that third additional dose. That could well change, but that's where we are right now. And then just a reminder that in general, you're going to give the age appropriate dose to a kid. So if they change ages between the first dose and second dose, you change doses. Now, there's this other little squeezed into the EUA and now on the CDC website is kind of this idea that people who are within 3 weeks of their birthday can kind of choose which dose they want. This seems sort of confusing, but I just thought I would let you know. It's actually come up at one of our vaccine sites already. But it basically says that the individuals who will turn from 11 years to 12 years of age between their first and second dose, and I think we just need to assume that 3-week window, in the primary regimen may receive for either dose, either the pediatric Pfizer or the adult Pfizer. So if you have a parent who comes and says, my kid's going to be 12 in a week, and we just want to go with the adult dose, you're allowed to say, okay. All right, that is it for the clinical updates. These are, Pfizer does continue to have training sessions. These are the ones for this coming week. And there are some others that I still need to track down, and we'll try to send out or amend this slide. Okay, then we've got some immunization team reminders. And I don't know if, is Katie on the call yet? Maybe, I think she was going to join us later. So let me just run through.
Hey, oh, sorry, Miranda.
Yep.
I think if you just kind of update the, like refresh the PowerPoint, it has like the messaging update on it too. I put that right before the NIMSIS reminders.
Oh, sorry. Okay,
oh no,
let's
it's
see if
okay.
I know how
If you just go through, it's just at the very top, there's like a little like arrow that's like a circle at the top. You just like,
let's see. There we
yes,
go.
that's it. That's exactly it. I just wanted to share those messaging updates because I thought they were interesting.
Let's see. We'll go here and there you go.
Oh, okay, great. It's slide 21, I think. Yes. One more. Yes, great. Okay, awesome. So is it okay if I just share those before Katie goes?
Absolutely.
Okay, awesome. So this is the main messaging update. There's a little link to a kind of a cool video that David Grace found that is really up, from University of Washington, that updates regarding the uptake in cases. Uptick in cases, sorry. So, and the increase in cases. So the first one is that getting vaccinated with the primary series is still really important, because the number of cases that are the thing that's really driving the uptick in cases is really the unvaccinated number. So I think we have on our website, we have a link to the website. I can put it in there, but it shows what percent of breakthroughs we have. So it's still about 17 to 20% of unvaccinated cases being the breakthrough. So that still makes it 80% of the people getting who are unvaccinated who are driving the surge. So just kind of a reminder to people, like, get vaccinated to the primary series. So the unvaccinated group is causing a surge. Also getting your booster. So after 6 months, there's a lot of data now that's showing that you have waning immunity. So that has some data showing that both vaccine-derived and natural infection immunity wanes over time. The vaccines are still really effective, the primary doses at preventing hospitalizations and death. But because there's waning immunity with the booster, we can really try to reduce the transmission potential when in the winter time, so many more of us are indoors. So that's kind of the second reason from in this little article, this little like update that shows that. And then it also shares that people are much less cautious this time than last year. So they showed like a huge percentage of decreased mask wearing and more gatherings and more mobility. So just trying to remind people to wear their masks and avoid the crowds. And also they show like a seasonality in COVID, that it's highest in winter time. So they looked at it globally, showing that both in the United States and then other places that are experiencing winter now, that you have a higher COVID rate. So can you show the next slide? Because that's where you can get this little update here from this link. And it basically shows insights from the new COVID modeling. So it's kind of nice because it's only 5 minutes long and it gives a nice summary. And then next slide. And then just kind of the impact. So I don't know, I thought these slides could help you guys when you're trying to explain to your patients, like why, I've been vaccinated, why is there waning immunity? So just the fact is that any rise in the number of cases is putting even more pressure on the hospitals with the combination of delayed care, expected flu cases, and COVID-19 cases on top of that. We're definitely, more and more hospitals are declaring crisis standards of care because they're having less and less capacity to care for people in the hospitals. And then just bottom line messaging that COVID's not over, and just expecting that we'll have to pay more attention to COVID, and then getting vaccinated, getting your boosters, wearing your mask, and avoiding large crowds is some of the messaging that you guys can use in your work. And then there's a new misinformation resource that you can link to this little toolkit. So yeah, that's all I wanted to share. Thanks everyone again for all you're doing, and just wanted to share that resource.
Great, thank you. Yeah, I think whoops, sorry about that. Oh dear. Not quite sure what's happening there, but maybe we'll, that toolkit was released this morning, I think by CDC on misinformation. And let's see if that little refresh trick will work again. Nope. Goodness. All right.
I believe you have markup turned on.
Oh, do I? Hang on. Is that this? All right, well, maybe I'll just try not to wiggle my little thing around. No.
Yeah, it's got the pencil. Well, if you guys can hold on real quick, perhaps if I can take the screen share and then I'll give it back and hopefully it'll let you.
All right, that would be great. Sorry, don't know how I did that.
Okay, Dr. Durham, if you want to go ahead and share again.
Thank you. All right, updates from the immunization team. So reporting, this is just reminding all of us that we need to report COVID vaccines into NMSIS. Really, the benchmark is 24 hours. We know that's not always possible, but as close to as possible. The doses should be reported accurately and completely with as much information as possible. I mean, we really do have an amazing kind of database of information, but because there have been so many vaccines, like matching people their first and second doses, if the information isn't quite perfect, the more information that we have to match in the database, the better. If your location has a backlog of doses that need to be reported, please reach out to the New Mexico immunization team. And again, the email is covid.vaccines@state.nm.us. And they can help you through. And please reach out for any barriers to reporting, which include data exchange issues. So people whose EHRs are supposed to be reporting and have glitches, the team can be helpful with that. This is an exciting new development, which is we are going to have QR codes on the immunization records. Sorry, the first one is just if you do find errors on a patient record, you can also email that same email, and you can do it securely, and staff can make the corrections on a patient record. So if you can see that there's sort of like your patient has been listed under two slightly different names, if you email that information to the immunization team, they will merge them and make that person whole again. The QR codes should be available really starting today. Hopefully Katie will join us and can let us know if that actually happened. They'll be visible on the immunization records pulled from the public portal, so on the VaxView side in early December. So right now, if you're a provider and you're printing out someone's record from NMSIS, you should be able to see that QR code. And starting in December, if people go into VaxView, they'll see their own QR code. The team is getting a QR resource guide together, so stay tuned for that. And this is Colorado, but they are using the same vendor. So that's sort of what it should look like. The NMSIS reminders on reconciliations, all COVID-19 vaccine providers must complete a weekly reconciliation in NMSIS that is in the CDC provider agreement. And if you're not doing the reconciliation, it can impact the COVID vaccine orders. If you're having any trouble with that reconciliation, there's 3 ways to reach the NMSIS team. You can call the help desk and the number is there. You can email that covid.vaccines, and there is a resource guide in the NMSIS reports section. So we know this is just like, there's just so much with COVID vaccine. So, you know, sympathetic about all the requirements, but also just stressing how important it is. Staff changes, also good to keep up to date. We've talked about before on the call, just that it is how the NMSIS team reaches out when there's new information. There is information about staff changes also in the resource guide in NMSIS. And then vaccine finder reporting, yet another reporting also in the CDC agreement. But this, if we're not keeping our doses up to date in vaccine finder, that is what the CDC monitors to see how many doses we have on the ground. So if they think we have a lot of doses and we don't, that can affect our allocation and ordering. And so, and again, if you're unsure about reporting to vaccine finder, reach out to the immunization team. The other thing about Vaccine Finder is that you can list yourself and your site on Vaccine Finder. So both on the statewide app, but you know, if you're not on the app, this is another way that people can find you. And if you're, I noticed Tanya with Corrales Fire Department, she is on Vaccine Finder, her sites are, but it links then to the scheduling, which she does through the app. So a hybrid is available. Again, my favorite CDC web page, which is the interim clinical considerations for vaccine. It just gets longer and longer, but it pretty much, if you have the patients, has everything you need. And that takes us to RTS updates. Chris, I don't know if you have anything this week. I left the same slides from last week.
Essentially just monitoring booster appointments and kids vaccines. Guys, I can't thank you enough for adding the availability last week to the application. We have more and more availability, so as that crowd continues to get vaccinated, we should be able to handle the load. We'll review some of the changes on Thursday that are coming into the app. But other than that, we're doing good. I guess I will say that there will be a strong push on messaging for boosters here in the next couple of weeks. I'm not sure if you all are going to talk a little bit about that. You may want to address that a little bit. All of that to say, we'll need the appointments in the application in order to support the volume that we're hoping to message. So the more appointment spots that you can put into your calendar, the more folks we can hopefully usher to your sites. And that's it for me, Dr. Durham and Dr. Putterham.
All right. So again, questions of any vaccine related nature can go to covid.vaccines@state.nm.us. It's also a good way to get hold of the NMSIS team. This is a mural in Nob Hill. And I just want to say again, thank you for all that you do. It really is an amazing effort, New Mexico wide. And that is all I have. Let me see, do you see Joelle or Katie on the call? I just want to see if they had any other updates for Joelle. Sorry. Do you have any updates for the group about ordering?
Just want to remind everyone that those who have ordered in our Pfizer pediatric over the weekend, those doses will be uploaded this evening. We are still waiting on allotments, so we may have to do some adjustments, but we'll try to get out as much as we can out for delivery of next week. We are still finishing up our third wave of the original orders of Pfizer vaccine for the pediatrics. Those ones are still coming out this week. There'll be normal ordering cadence for Thursday, which is Veterans Day. So if your office is closed, please send me an email so that I can make sure that we figure out a time where we can get you guys the vaccine so it doesn't fall on the day that you're going to be out of the office. We did send out the November schedules for Thanksgiving, so be aware of that as well. We shouldn't have any issues as we do most of our ordering so that all of your orders are delivered on Mondays. So that shouldn't affect anything, but just kind of do be aware of those when you're ordering for your vaccine for that week. And those are the only updates that we have. Thank you.
Great. And Joelle, do you anticipate that cadence continuing where basically Tuesday is going to be the pediatric order upload day and then hope to get them by the end of the week?
I am not exactly sure.
Okay.
Since this is the first week of how we're going to get our orders in for that, I'm not sure if they're even going to be delivered by Friday. I don't have very good tracking at this point. As soon as I get all the information, I will let everyone know. But ideally, what I'm assuming that is that the orders actually will not arrive till probably Monday this week because they're still trying to catch up for the orders previously. But so that's what we're hoping for, but I will keep that you all updated on any changes.
Awesome. Thank you so much. Great. So I think we can do questions then. And I see one in the chat. I'm getting questions from patients that received the J&J and now want the booster of Moderna. They want to know why they only get the 0.25. I've been saying it's because they are considered fully vaccinated, but is there another explanation? Yeah, I don't have another better explanation than that. I mean, I think one interesting thing is that you know, there is some evidence that the J&J immunity is more lasting than the mRNA, but just not as good to begin with. And I know that's kind of an aside to your question, but yeah, and I mean, my guess is they were just trying to make sort of a standard booster recommendation. I mean, it's still sort of a higher dose than the Pfizer full dose. So don't really have a good answer for you on that one. Any other thoughts for the person who asked that question? Okay. And let's see. Good question. We've received queries about whether there are any support groups or other resources in New Mexico for people with long COVID, specifically asking for resources in northern New Mexico. You know, I don't have the answer to that. I'm wondering, do other people on the call know of resources? And if so, chime in or put it in the chat. And if not, we'll do some research and get back to you next week. Okay. And then someone asked for Joelle's email. She put it in the chat. Let's see. And Chris, one for you. Can we get your email to reach out for issues? I haven't been able to reach you at the email listed on the RTS site.
Yeah, I sent that directly to her, but here, just so everybody has it, chris@rtsolutions.com. Also, here is my cell phone. You feel free to text me. And that's the quickest, surest way to get a hold of me.
All right, and then just maybe a reminder about the standing Thursday meeting, right?
So
On this link.
correct, it's the same link. You'll get reminders if you're in the app as an admin. We review all changes, updates, take requests on Thursdays. So please join.
Great, thank you. And let's see, it looks like Carol raised a hand. Go ahead.
Hi, good afternoon.
Thanks.
Couple of questions. We will be doing our pediatric 5 to 11-year-old vaccine clinic on the 20th. And I had asked a couple questions last week. So if I can see if we've got an answer this week. One is to Chris about the reactivating people. Do I just need to send you a list of emails and names for you to reactivate? Because we're getting close and I need those people reactivated.
Yes, we're hoping to have that. It just keeps getting dropped in priority.
Right. Yeah,
So we'll try and have that ready for you by Thursday. But if you send me just an Excel spreadsheet, we can reactivate them quickly, or just throw it in an email. All I need is their email.
just their email. Okay, perfect, great. And then I had asked a question about, because some of these littles, as I'm calling them, as we're calling them, they have little bitty arms. Was there already a change to in the administer vaccine section where you could choose the anterior lateral thigh instead of just a deltoid?
So that's a question for the Department of Health and/or immunization team right now. The routes for vaccine for kids are, let me log in, get the exact routes, but we would need to add additional routes if we need to.
Okay.
Yeah, and
Go ahead.
I think CDC is still saying, and Joel, definitely jump in here if I'm wrong, but that the deltoid is, still the recommended, using a 5/8 to 1 inch needle. Most of the kit, I think all the needles getting sent out are 1 inch. But if you have one, always for adults or kids, if there's concerns or reasons not to do it in the deltoid, the anterior, the lateral thigh is also an option. I don't know why I cannot say that word.
It's hard to spit out. Yeah.
Yes.
And then one other thing. So in prepping for this clinic, I've done a fair amount of just experimentation with I've got 2 profiles that I use. And the ability for a parent or guardian to sign that digital consent, it's buried pretty deep in there in that portal. We currently have 198 people. We haven't even advertised our clinic yet on the 20th, and 600 total, and we've got 198 people that have just found it by looking. But only 52 parent guardian consents formed. So those digital consents. Is the DOH planning on putting out some kind of communication? Like I said, I think it's challenging for people to find if they don't have their own, if the parent guardian doesn't have their own profile. And then if they don't think to look down on the left-hand side for that word for the page dependents, they're never going to find that digital consent link. I've had two people that are pretty tech savvy, I'll say, are comfortable anyway, working on computers. I've had to like send them screenshots. Okay, now you need to go to this page. Now you need to do this. So it's kind of buried in there deep, just to put it out there that, so right now we're looking at just about a quarter of our people, a quarter of our kids coming in will have those digitally signed consents. So like I said, just to put it out there.
Yeah, that's great feedback. Chris, do they get a reminder when they get the medical questionnaire
They do, to fill it out online. And Carol, part of what you're, well, here, I'll just show you Abby's stuff real quick. Go ahead and share this. Also, I'm sure we, as we continue on in this adventure, some of this will go through redesign. However, right now, we have the dependent here. We have the dependent on the left-hand side, and on vaccinenm.org, this whole homepage is being reworked right now. Let me see if I have a, oh, here you go. This is essentially where it's heading. So when you click to schedule your kids, you'll see it'll walk you through how to add dependents to your profile. What we can also do is create basically a walkthrough in terms of how to sign your online consent. But a parent, when we go to dependents, so like with Abby, she'll have the online consent form here, just like the medical questionnaire. You won't be able to see it unless you are a parent of this person, or I should say a guardian/parent. So those are the only people that will be able to see the consent forms. Does that make sense?
Yeah, no, I've been playing with it a lot, Chris.
Okay.
Yeah, and my concern is that a parent guardian who does not have their own profile will never see this. A parent guardian who does not have their own profile will not have been able to link their child's profile.
Yeah, so the challenge here is that in order for this was direction from the legal team over at DOH, we needed to verify that
Right.
it was indeed, so when the parent logs in, we have a record of them logging in, and then when they go to sign it, we have a record of them signing it.
Right.
That's the reason we have the online consent the way that it is. It's tied to the guardian. There's not a whole lot of wiggle room there. However, we do still give them the ability to download and print it and bring in a printed copy if need be. Does that, and I agree with you, Carol, we're probably going to need to refresh this. We don't want to go too far from what people are used to, but I agree, the dependent section and the consent form, you really have to know what you're looking for in order to find them.
Right.
So
yeah, no, thank you for the time on this meeting to voice my concern about that. I appreciate you guys.
of course.
And Chris, while we're on this topic, from Susan, on Monday, each time the clerks looked at the parental consent, it was not signed, even though the parent and guardian said they signed them. Did they have to save them or do something else when they signed the consents prior to arriving at the VAX pod?
Most likely they did not sign the document.
Ah, okay.
Digitally, I should say, they digitally did not sign it. So like, for example, when you we'll do Abby, when you come into the consent form, you say, I grant consent. You have to put in the relationship to the child. Oops. And when you submit it, the attestation that everything you're saying is true and accurate, and then it's signed. And so if you were to go look at Abby's consent over at Bonifacio, you would be able to see that she has the consent form. You would see what they saved. So if they say they signed it and it's not signed, they didn't sign it.
Chris, do you think it's possible that they're clicking on the thing that says vaccine consent form and typing into it and thinking that that's saved as the consent?
You can't type into this. This is a flat PDF, so you'd have to print this out. But I mean, that's a good point.
Yeah.
Hey, Chris,
Yes.
since we're on the topic of consents, I know this is a question for Thursday, but we're going to be off Thursday.
Mhm.
Is it possible to, you know how we can go and see who's got the appointment a certain day, and if they filled out their questionnaire?
Correct.
Could you put on there if they've done the digital consent as well?
Ooh, girl, you're gonna like what's coming. Yes, that is coming.
All right, cool. Thank you.
Okay.
Great. Okay, on another topic, herd immunity. And Dale's asking, is herd immunity a concept that does not apply to COVID-19 vaccinated? I think this is a really interesting question. And just, I'll say, there's no reason herd immunity shouldn't apply to COVID. But, the question at the beginning of the pandemic was just what % of vaccine do we need to reach that herd immunity? And I guess the answer we have is we're not there yet. And partly, again, there is this huge group of unvaccinated people who just aren't eligible for the vaccine. So the 0 to 11-year-olds, or now the 5 to 11-year-olds are eligible. But so that should help. But we always look at the percentages with the when we say X % of people in New Mexico are vaccinated, we're using the eligible population as the denominator. So if you take our whole population, that % drops down. So we probably do need to be, at least it's looking like need to be more up there, closer to 80% to achieve herd immunity. So yeah, more to come on that. All right. And it looks like, and sorry if I'm going out of order, but Allie has a hand up.
Hi, yes. So this is a question for Chris, or I guess more of a comment. Last time we had a vaccine event and we tried to add someone for flu, I got a message saying that I didn't have, I think, permission or some form of, it said that I wasn't able to do that. So we had to just do paper consents, but I didn't know what we had to do to make us able to do COVID and flu at the same site. Because we have flu capable.
Allie, why don't you direct message me your phone, and I'll ring you right after this meeting and we'll walk through it. Could just be a capacity element on the calendar, but we'll take a look.
All right. So ask him. Oh, sorry. And Barbara also has a question.
So that means we actually have to open flu slots. We can't just add them as people come in.
Correct.
I opened a couple of flu slots and it still didn't let me do it. So
Okay.
I'll go ahead and let him call me.
Okay. Thank you, Chris. We're going to try it again today.
Chris,
Okay.
here in Roswell, we had the same issue when you tried to add vaccine, but it would let you put them on as a separate appointment for flu on the same day, but it wouldn't let you do them both together. And I'd send it to Corey.
Okay, if you guys want to hang out on this call, we can take a look at it after we let the other providers go. We'll find out what the cause is.
Thank you.
And real quick, Chris, this Thursday, which is Veterans Day, and I know DOH is
Oh.
off, but will there be the Thursday noon meeting this week?
There will be. If you
Okay.
guys can join us, great. If not, no big deal. We'll repeat the meeting again. The meeting content, I'm sure, will be repeated.
Great. And is there anyone else who we missed with a hand up or any other questions? All right. Well, thank you everyone once again for joining. Also, if there are questions or topics that come up during the week, please feel free to email us. And I should just put my email in the chat. And otherwise, have a great rest of the week.
And those of you with flu questions, go ahead and stay on, and we'll take a look at that stuff real quick. Thank you guys for everything you do. We'll talk to y'all soon.